I'm going to explain the difference between psychiatrists, psychologists, psychotherapists and counsellors in this video. For the general public, often it's extremely confusing as to who does what in the psych world. We all have terms that are quite similar, and therefore it's quite understandable that it's easy to get confused about which profession does what. So I'm going to break it down for you in this video and explain so that it's much clearer. So first of all, we've got psychiatrists, and they're medical doctors. They prescribe medication and they usually cannot do any form of talking therapy whatsoever. But there's always exceptions, because some psychiatrists have taken a particular interest in talking therapy. And I certainly have met psychiatrists who do eye movement desensitization reprocessing over the years. That's called EMDR for short. It's a trauma treatment, and it's not really a talking therapy because it involves eye movements or tapping or sounds, and it's a highly credible evidence-based therapy that helps people overcome trauma or deal with anxiety that they're experiencing. Now, it's very rare for a psychiatrist to actually properly train in talking therapy, but it's not impossible, because they could enlist on a really good course and spend quite a lot of time actually doing that. But usually psychiatrists only actually get a little bit of an overview of talking therapy, so they understand what types of talking therapy there are, like what is CBT, what is psychodynamic therapy. So then they can refer their clients to the best type of approach for them. So they'll have enough information to make that referral, but usually they can't deliver the talking therapy unless they've really invested a lot of time in doing a therapy course. Now that's going to take them quite a number of years, and they've already invested an awful lot of time to reach consultant psychiatrist level. And people have to be a consultant psychiatrist to see clients in private practice, and that takes a tremendous amount of time. So it's very unusual for a psychiatrist to also be trained really well in talking therapy. So they're usually not going to be able to offer this. However, there's always exceptions. I mean, I've certainly met lots of psychiatrists that do EMDR over the years. I've yet to meet one that actually can deliver really good quality talking therapy and who's been extensively trained in that. So for talking therapy, you're normally going to see the rest of the psych profession. So that would be a psychologist, a psychotherapist, or a counsellor. So now I'll explain the difference between those three professions. So a psychologist is kind of next down in the ranking in terms of like the level of years of training that you would have to embark on to get one of these qualifications. So psychologists have a psychology undergrad, and then they've done a doctorate to become a psychologist. And they can deliver psychotherapy, and usually they're trained in at least two types of psychotherapy where they can actually deliver that type of psychotherapy or those type of approaches very well. They may actually train in more approaches somewhere down along the line after they've finished their psych doctorate training course. So if someone is a psychologist, they're usually going to have done a 3-year undergrad, and then maybe they've taken some time out to do work placements to then get on to their 3-year doctorate program. Maybe they'll have done some masters in between. So, we're looking at like 6 years at least, maybe 7 years, maybe even up to 8 years of time in their life that they have dedicated to becoming a qualified psychologist. So I'm a psychologist myself. My training was a 4-year undergrad, and then I did a 3-year doctorate, and then I did 2 other specialized postgraduate programs. One was in cognitive behavioral therapy, and another was in another psychology related topic. So it's really extensive training. I've spent 8.5 years of my life investing in the process of becoming a psychologist, and I'm a psychologist who can deliver psychotherapy. So any psychologist who's delivering talking therapy can also call themselves a psychotherapist. The only exceptions would be if the psychologist goes into research and they go down more of a research route, then those psychologists are not also psychotherapists. However, if you see a psychologist for help with an issue that you're experiencing, then your psychologist is going to be a psychotherapist as well. So pretty much all psychologists, or most psychologists, are also psychotherapists. So then we go to the next down in the ranking, which is psychotherapists. And this does get kind of confusing because psychotherapists and psychologists kind of do the same job, particularly if it's in private practice. But there are some exceptions. So Usually, but not always, a psychotherapist will not necessarily be as qualified. So they might not necessarily have reached doctorate level, although these days actually some psychotherapists are even doing doctorates. But there are some limitations on the type of work that psychotherapists can actually do. So psychotherapists usually can't diagnose the full range of disorders that people experience. But some psychotherapists, such as cognitive behavioral therapists, can actually diagnose anxiety and depression. But apart from diagnosing their areas of speciality, such as anxiety and depression, you'll usually find that psychotherapists can't diagnose any further than that. For example, if you need a diagnosis for a personality disorder, such as borderline personality disorder, it's going to be a psychologist or a psychiatrist who can diagnose that properly. It's not going to be a psychotherapist who can diagnose it. So any of the more complex mental health conditions, you're not going to be able to get a diagnosis from a psychotherapist. So there's limitations in terms of the assessments that they can actually do. And the type of psychotherapists that have fully trained in a credible CBT course, which is going to be accredited by BABCP, if they're in the UK, if they've done that course, then they'll definitely be able to diagnose anxiety and depression, but that's where it ends there. Every other diagnosis that's in the Diagnostic and Statistic Manual, the DSM-5, is going to be disorders that psychologists and psychiatrists can assess and diagnose. However, you can still receive really good quality talking therapy from a psychotherapist as long as it's within their area of expertise and they've been trained to help you with that disorder. Then we've got the term counsellor. So the term counsellor might be someone who has trained in some kind of basic counselling courses. They've trained in some kind of talking therapy. It's usually person-centered or humanistic, which is very much about the therapeutic relationship and giving people a space where they can open up and talk. But they're not necessarily trained in evidence-based therapies. So evidence-based therapies are research-proven strategies, research-proven protocols. We're given very clear guidelines on how to understand someone's condition, which is called formulation, and we're given a very clear toolbox of strategies that have been highly researched and have been proven as being incredibly effective to help people with certain disorders. So for example, if someone has panic attacks, if they have panic disorder, I am going to offer them the solutions that have been proven to be the most effective. These are going to be very specific evidence-based strategies. A counsellor is not going to learn that. They're going to learn how to listen very well. They're going to learn how to do active listening, which involves paraphrasing to help someone feel like they're really understood. They can hold a therapy session. They can hold someone in the therapeutic space. They know professional boundaries. They've got very good skills in terms of offering empathy and offering understanding. They may occasionally offer a little bit of feedback or a little bit of insight. But in terms of actually offering strategies and offering approaches that are in line with the best research, your counsellor is just not going to be able to go to that level or that area of depth. You'll get great listening, you'll get a nice therapeutic experience if you get a good match in terms of the therapist who's a good match for you, but you're not going to get something that is highly proven and highly researched and highly evidence-based to actually help you with specific problems. So in terms of skills, a counsellor is not going to really be that highly skilled in terms of offering really good quality solutions. Now, that's not to say that it's a complete disaster and they can't help you at all, because there's a lot of power in the therapeutic relationship. Sharing your deepest, darkest secrets with someone and having that space for you to explore your issues for a full hour every week is amazing, and there's a lot of power in that, and it can really help with emotions such as shame. If you bring things that you never talked to with anyone before to that space, you can really benefit a lot. And also you can discover things yourself by just saying them out loud and saying them in a space where you're being so accepted. So there is a lot of power in having a therapeutic relationship in your life, but you want to really be familiar with the rankings of these professionals and the limitations of these professionals. So counsellors can offer a therapeutic space, can help you feel understood, help you feel listened to. They're probably not going to be very good in terms of strategies because we just don't know what training they've received in relation to that. Maybe they've done some short courses, but have they really, reached the top of their game in terms of offering evidence-based therapy? No, they haven't. And they might go on to do that in the future, but just not yet if they're calling themselves a counsellor. It gets more complicated with psychotherapists because you've then got psychotherapists who specialise in cognitive behavioural therapy, and the ones in the UK who've reached BABCP are incredible, and the level of training they get and the level of expertise that they have in terms of helping people with anxiety and depression is phenomenal. And they might actually go on to specialise to be able to treat other disorders using CBT, such as they might do couples therapy using CBT, and then they can offer treatment to couples as well. And then it gets more confusing with the other psychotherapists, because then we want to ask, well, what approach do they offer? And that's where sometimes they've just learned an integrative approach, which doesn't mean they can offer evidence-based therapy. They just know like different types of approaches. And that's where you really want to ask the questions of what specific approaches have you trained in? How long was your training course? What has led you to call yourself a psychotherapist? Like, did you do like a 2-week training course, to use that term, or have you done like 5 years of training, 6 years, 7 years of training? Because the term psychotherapist is not legally protected in the UK. Anyone can use that term. So you really want to fish a little bit further, see if you can get access to their CV, or see if there's some information on a website that they're listed on that will really detail like when did they do their training, what full-time courses were they on, how many years were they on those courses for. And if the person that's offering you talking therapy, whether they be a psychologist or a psychotherapist or a counsellor, whoever this person might be, you want to really find out how many years of full-time courses have they actually been on. And if there's anything less than like 6 years of training full-time, then this person is just not really in a good position to actually be offering any type of therapy. And then also you want to know the professional bodies that they subscribe to, and are they the correct professional bodies that they should be subscribed to. So for psychiatrists, it's RSC Psych, and for Psychologists is HCPC, for CBT therapists it's BABCP, and then for psychotherapists and counsellors it's going to be UKCP and BACP. Now this is really confusing for people, so I will give more details about all of this in the description below. But I really do want to offer advice on this, because a lot of people call my clinic and ask for a psychiatrist when actually they mean they want to see a psychologist, and vice versa. And we really need to educate people a lot and really talk to them a lot about what their real needs are, so that we don't end up prescribing medication to people who actually could do with having talking therapy, and that the people who are really complex and need to be seeing psychiatrists are actually referred in that direction as well. Of course, a good place to start for anyone is to embark on some evidence-based therapy before actually trying any medication. And then if that really is not working, we can then get an opinion from a psychiatrist, and the psychiatrist can give some recommendations in terms of medication and prescribe if they really feel that that's required. But using medication as your very first thing to go to is often a dangerous place to go to, because then you may end up depending on medication where you don't really need it. And that's what we see happening with a lot of anxiety disorders. I often meet people who are on tranquilizers. They've been prescribed things such as diazepam for panic attacks, and they really actually just need strategies. They need really good quality CBT from an expert in CBT, someone who's properly trained in CBT, so that they can overcome the difficulties they're having without relying on medication. So if you've got any questions about the various different psych professions, the various different mental health professions, you can ask me a question, leave a comment below, and I'd be more than happy to clarify any confusion that you have.